Established in 1947 with a mandate to conduct research on disease and prevention, the Medical Research Council of the Gambia is expanding a major commitment to the training of young researchers across Africa on disease control and prevention through research methodology for future. This latest training assembled participants from across Africa for an advanced bioinformatics course aimed at equipping young researchers across Africa in bioinformatics analysis, with a focus on next-generation sequencing data quality control, assembly and reference mapping, among others. The course also seeks to engage researchers who are part of global surveillance networks and have interest in learning how to carry out next-generation sequencing and analysis of bacterial genomes. Professor Martin Antonio, Principal Investigator and Lead Scientist in Molecular Biology at the Medical Research Council, explained the fundamentals of the training.
The training workshop that we are embarking on is targeting a couple of bacterial pathogens that causes a lot of outbreaks and havoc in our country. Part of what we're doing as the training, we've invited colleagues from throughout Africa, as well as our close collaborators from the Sanger Institute in Cambridge in the UK. So the Sanger and Professor Bentley will speak for the institution, but they are one of the global leaders in the world for genome sequencing.
Partnering with UK-based world-leading Genome Institute, Welcome Sanger Institute, the group leader of the institute, MRCG, is on a first quest to boost future disease control research. Professor Stephen Bentley said the training will equip participants drawn from different countries on how to learn and apply the technology currently used in tracking COVID-19.
With partners around the world to apply genomics to understand these pathogens, understand how to prevent the infections from these pathogens. So the major focus for this workshop is to enable as many people as possible from as many countries as possible to learn how to apply the technology as it can be currently used now, and as Martin mentioned, as was successfully used in COVID tracking.
Windy Bloss and Jeremiah Kwame, participants from South Africa and Ghana, both expressed optimism that the training will improve their intellect in research and processes of data analysis in their research work.
This training, it will really benefit me, especially I've been working as a technical staff, technologist. So now when you're doing the technical stuff, you process the samples and then you send the results out. You don't know what's happening, what's going to happen after. So now I'll be able to analyze the data that I've been sending out. It's not only to process the work, so now I'll be able to analyze the data and know how to work with the data and how to help the community with the vaccines and develop new vaccines, especially for strep pneumonia.
As I am here, I'm eager to learn. So some other participants, I also hope that they have the same eagerness that I have to learn. And I'm sure that as we leave this training, we'll be equipped with, if not everything, but at least something that would help us when we get back home.
The Medical Research Council of the Gambia has been the leading research institute in Africa for 76 years with a focus on disease interventions, saving lives and improving healthcare across the globe. Sillah, GRTS.